My name is Sanjay Gupta. I'm a cardiologist in York. Today's video is on the subject of chronic illness and the true impact of chronic illness on the patient. And this video is entitled Chronic Illness and the Erosion of Identity. Chronic disease doesn't just affect the body. It reaches far deeper. It can unravel a person's sense of identity. It can change how they see themselves, and it can change how the world sees them. Today I want to talk about something we rarely study in medical journals, the loss of self, and why understanding a condition is incomplete without understanding what that condition does to the person living it. When someone becomes ill long term, they may lose roles, the role of a worker, parent, athlete, contributor. They may withdraw socially or be seen only as a patient. The routines and freedoms that shape their identity may be gone or altered beyond recognition. And therefore chronic disease doesn't just place a physical toll, but also a spiritual and psychological one. People often say, "I don't know who I am anymore." In medicine, we are trained to name the disease, not always to ask what it has taken from someone. But I think real care begins with asking who the person was before and who they're still trying to be. A diagnosis is therefore only one sentence in someone's life story, not the whole chapter. And I don't think you can treat the illness fully unless you've understood what it has disrupted: identity, purpose, dignity. Chronic illness involves ambiguous loss. There's no funeral, but there is grief. Grief for a life once lived. Grief for the body that no longer behaves. And this grief is often, unfortunately, minimized or unseen, even in clinical settings. As clinicians, we ask, "How's your pain today?" but not, "What have you lost?" or "What do you miss most about your old life?" And I think that as clinicians, we have a responsibility not just to monitor labs or prescribe drugs, but to hold space for that grief, to see the person behind the pathology, to ask, who were you before this? What are you still holding on to? And what does healing mean to you? Sometimes the most powerful prescription is to help someone feel seen again, not as a patient, but as themselves. And therefore we need a model of care that honors identity, not just biology. A model of care that understands the condition not just in terms of symptoms, but in terms of its effect on selfhood. Because healing isn't just about symptom relief. It's about reconnecting a person to their life. In chronic illness, people are not just surviving a diagnosis. They're rebuilding who they are. And if we fail to see that, we've missed the most human part of medicine. If chronic disease has changed your identity, or if you're caring for someone who feels that way, I'd love to hear your story. And if you believe medicine should care for the whole person, please do leave a comment below, because I think this is a conversation we need to keep having. Thank you once again for your time. I appreciate each and every one of you who takes time out of your day to listen to me. All the best.